All right, to continue talking about anticipatory guidance, about the third thing that we talk about is habits. And the basic habits we see out there are thumb sucking or pacifiers. And the question I always get is when should we stop these activities? I will state that there are a lot of other habits that we pick up upon examination. Sometimes I've seen people using hairpins, girls that picking and actually causing some dental problems or gum problems. But the American Academy of Pediatric Dentists suggests that we start trying to get these habits stopped, mainly the thumb sucking and the pacifier, between the ages of 2 and 3. There's some people that are really strongly advocate that. I am not one of those, especially with pacifiers. The problem I see that happens a lot is these parents get convinced at 2 years of age, we're taking that pacifier out. And what happens is the child looks around and then they go start using their thumb instead of that pacifier, which can be cause a lot more problems. And it's a lot harder to get rid of. So we do encourage them between 2 and 3 to stop these habits. And we have various ways we can do that to help encourage the parents. The bottom line for most of these is that the child has to want to quit. If the child doesn't want to quit, we can make any type of appliance. We can put nasty tasting stuff on their fingers. They will get past it. And so the trick in this, if there's a trick, is to get the child to want to quit. I found, at least when I went to school, now they start a little bit earlier, but what I see a lot with kids that are thumb suckers or whatever is that once they start going to school, that goes way down. And it's kind of one of those positive peer pressure things, is their friends make fun of them. And so until they hit school age, I don't really worry about it, combined with the fact that their permanent teeth start coming in around 6. And as long as you stop the habit, even if they've had some skeletal changes or some dental changes, as long as you stop the habit before their permanent teeth come in, their permanent teeth are basically going to come in where they would normally come in. So as long as I know that, I've got a buffer up to about 6 years of age. I don't push too hard. Now, if we do have a child that wants to quit, but now it's such a habit that they don't even know they're doing it, we can definitely make an appliance for that. The bottom line is they have to do it really hard and really long for it to make any big changes. And I've just found that most times once they go to school, they pretty much stop on their own.